okay, we will try to talk about the reduction of contrast media dose injection. So, as you know, we started with the full dose in the beginning. So we inject 4.8 milliliter of Sonoview in a vein of the patient just to have something acceptable. After some time, the dose became 2.4 milliliter. And for a big time, this was the dose normally accepted. Now, with all the premium scanner, and of course with Resona 7 is the same, we can use 1 milliliter dose to have a perfectly working examination. But if you look with sufficient attention, you can recognize an excessive blooming on Resona 7 clips, even if you inject just only 1 milliliter of Sonoview. We can look. This is a normal liver examination. We inject, and you look, that is so full of contrast that everything here in the lower portion is obscured by the contrast. It's a blooming situation. And even here, this is a spleen. And okay, spleen with an angioma here. But look, this spleen is full of contrast, but all what is happening here is not perfectly visible because of all the blooming. So we started to try what is happening if we inject 1/2 of 1 milliliter to 1/10 of milliliter, so 0.5 to 0.1 milliliter, and let you judge the result. Of course, we cannot use normal syringe of Sonoview. We substitute the syringe with the insulin injection, and we do that, and we push the small amount of contrast inside the tube to the needle and the vein. And now we look at one of our nerves. With this angioma is well known, even if the B-mode image and color are not really helpful. And look what is happening at normal injection, 1 milliliter, and 0.1 milliliter. What you see immediately, that the lesion is assuming the contrast, and the liver is not assuming the same amount of contrast. And of course, you don't obscure the lower portion of the liver. And of course, it's easy visible the nodular peripheral enhancement and the bridges and so on. And at 2 minutes here, 1 milliliter, and 1 minute 28, and 2 minutes 24 at 0.1 milliliter. The semiology of the lesion is absolutely visible, recognizable, even at 0.1 milliliter. So why to use more? But we look at different cases. This is an overweight patient with metabolic syndrome, and this is a lesion about 10 centimeter deep near the diaphragm. And this is V-mode, and this is contrast. Look, the lesion is assuming the contrast here, but a small amount of contrast inside the liver. So we are at almost 12 centimeter deep. This is 6 minutes. 6 minutes, and look, the lesion is full of contrast. And we see quite well the lesion not obscured by an excessive amount of contrast. And this is a typical hemangioma with typical CEUS behavior. This is another case. It's a first scan after breast surgery, and there is this lesion here. Okay, it's a normal patient. Probably I was thinking about the hemangioma, but in this case, of course, we need to do CEUS because he's a cancer patient. And here, what is happening are 0.1 milliliter. Look, no contrast in the liver, but real contrast in the lesion, and you observe peripheral global enhancement here. 24 seconds, 1 minute, the lesion is full of contrast. And even in this case, the answer is atypical hemangioma with typical CEUS behavior. So even 0.1 milliliter that really reduces dose, you can obtain good result. Okay, this is a case similar to the case presented by Professor Jung before. We was thinking there is a Rand-Osler disease for this lesion, but because in a family of Rand-Osler, but what is happening with contrast? Look at this. Absolutely no Rand-Osler. 15 seconds, and this is 22 seconds. This is an high flow hemangioma, and really easy to understand. So no Rand-Osler at all, but is a lesion and is a high flow hemangioma, very recognizable and full of contrast. The lesion not obscuring the lower portion of the image with an excessive amount of contrast. Okay, this is a casual observation in a young lady. What's something, a kystic lesion, but near there is something slightly hyperechoic here. We don't know what it is really. Color is not very helpful. We tried also with elastography, and we see something that I cannot interpret. I don't try to do that because I don't really believe in the possibility. And what we use always, some portion are probably more stiff, but okay, contrast is more useful. And look what is happening. There is a vessel here in the central portion of the lesion. The lesion is much bigger than we understood before. And this vessel is providing contrast from the center to the periphery of the lesion. Here, the same. We are now at 40 seconds. And at 2 minutes 34, the lesion was here, and we see the central portion. Not really wash out, but the lesion is full of contrast anyway. It's not more recognizable after 8 minutes. But look how this liver is full of contrast after more than 8 minutes from the beginning. This, I think, is a very good thing from mind, right? Okay, we started with some sort of MIP, maximum intensity projection, and look what is happening. So the vessel here is providing contrast from the center to outside. Okay, I really don't understood what is happening. So we have done MRI to understand. And look at MRI. Okay, this is T1. T2 is very, very, very high in intensity. No fat in phase out phase. And of course, contrast from the center to the periphery, and full of contrast in late phase. It is very similar to what's happening with the CEUS. Biliary phase, say no biliary vessel inside, and the diagnosis was inside-out hemangioma. It's a very rare case, first and probably last seen on my life, but it's well described on the books. So this was the correct diagnosis. I report because it's never seen once. Okay, now a very easier case, young patient with recent finding of hepatitis C. The finding was recent, but probably not the disease. And one lesion here, subtle to see, something better with this trick. And of course, color was not very helpful. But the patient had another lesion here, hyperechoic. Of course, it's a normal one. I was thinking there is an hemangioma, but not in this patient. And there is a sign, hypoechoic sign all around, so no good sign. And even in this case, color is not helpful, unfortunately. So we are doing contrast. The lesion is taking the contrast very, 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 very easily. Complete fural contrast in the arterial phase. In portal phase, we start to see some subtle washout, very subtle. But at 4 minutes is less subtle, and there is washout, and at 6 minutes is washout. This with 0.5 milliliter, because is an hepatopathic patient, we use a little bit more contrast than before, of course, but I think with 0.5, look at here, 1 minute 24, and look at here, 6 minutes, you still have full contrast inside the liver of this patient. And this is the second lesion, washout here, 6 minutes 42. We started a second injection here, just to understand if there is a arterial enhancement. And there is an arterial enhancement, of course. So our idea is that with this machine, you can use low contrast to don't mask the deep portion of the liver. And even with this low dose, you still have so much contrast inside the liver, even in a chronic hepatic disease patient. Okay, this is a strange case for me. Is an overweight patient with a metabolic syndrome, even in this case, and I was thinking about geographic border steatosis at the beginning. We tried to understand what is happening with elasto, but apparently the more fat was more stiff. This is confounding. I don't know it's very helpful, but I use every day anyway, every time anyway. Of course, I show you the MRI that we have done before of the contrast, because the idea was to understand if there is a fat inside, and yes, there is fat inside the liver, and this portion has less fat than the rest of the liver. So with this no contrast MRI, the idea with the geographic border steatosis was still there. Look, this is a in phase, out phase. So the idea was they're still there, but the color in this case is more helpful because there is some kind of restriction of the vessel inside this area. So we are thinking probably it's not really an area with different amount of fat, but should be a lesion. And for the reason we have done contrast, and this, you see, this portion is receiving an incredible amount of contrast in arterial phase, and there is in the portal phase all the liver is similar, but at 2 minutes, okay, small kyst there. At 2 minutes, there is a washout of this portion of this lesion. So no geographic border, unfortunately, because this is not the behavior. And we have done contrast with MRI. So I have the acquired contrast on arterial phase and still contrast on portal phase, and washout, still contrast on late phase, but in biliary phase there is a washout. So that biopsy was a cholangiocellular carcinoma. So very difficult to understand for me because there is no stenosis of dilatation of the biliary tree in this region, but the behavior was for a malignant lesion, and MRI was not a solution because we have done a biopsy to understand perfectly the diagnosis. Another case, young lady, Asian young lady with this lesion here. There's a small arterial vessel. We investigated the arterial vessel with Doppler, spectral Doppler, low resistance. So we are thinking probably at FNH because of this situation. We are doing contrast, 0.25 milliliter, and the lesion is assuming the contrast almost homogeneously, almost. 16 seconds is full of contrast, similar to the rest of the liver. 24 seconds, the lesion is completely full as the rest of the liver. But at 1 minute, okay, no, this is the, okay. 1 minute, you see subtle washout there, 1 minute 21, and the small amount washout at 3 minutes here. So the lesion is some sort of washout. So we was thinking in no chronic hepatitis, but in an Asian lady. So we had a well-differentiated ACC. This was our idea, but we have performed MRI, T1 in phase, T1 out phase, so this is the fat inside, T2, arterial phase, portal phase, late phase, washout in biliary phase, and diagnosis was steatotic hepatocellular adenoma. So in this case, contrast is a little bit misunderstanding, but anyway, a good way to use. And I thank you very much, and I hope you try to use less contrast on resonance 7 because you can obtain interesting cases. Thank you very much for your attention.